So the pharmacist role in oral health. Is there a role for the pharmacist in oral health or in medicine? Yes, the role of the pharmacist is not only dispensing medication, it is also educating the patients and medication management. And how does it work in medication management? Sometimes we, as dentists or MDs, prescribe a certain medication to a patient. If you don't have the exact name, you can ask the doctor if you can substitute it to a equivalent product. Also, you have the health promotion. Pharmacists do promote health and good oral hygiene and good oral health habits and good health habits in general. And also, they collaborate closely with the healthcare team. They are part of the major health care team in the world. So, they are trusted healthcare experts. They build trust between them and the patient. And most of the time, the patient would trust them more than the doctor or the MD. And they improve the health literacy by explaining to the patients what they have to do. As you know, the oral health starts with the mouth, whether it is for eating, for feeding, for speaking, for expressing emotions, and even the emojis on your telephone have expression mainly in the eyes and in the mouth. Eyes and mouth are very important, and you can see that the mouth is a door, open door for food, open door to bring us all the elements of nutriment. And not only that, it's a gate that has a curtain that opens on a stage, which is the gum, and the gum has to be healthy. And on this gum, you have the teeth, and the teeth are the very important element and the first job of chewing and processing the food. If you don't chew it, if you don't break the food mechanically, it would not help the digestion. You need to break it mechanically in the mouth and mix it to the saliva. And when it is properly mixed with the saliva and properly brewed in the mouth, then it goes to the digestive system, and then you get the digestion. So the main function of the mouth is to bring in food and nutriment, but make sure that it would be a good quality of nutriment, not this kind of fast food you see on this picture. So the mouth has a main function of bringing the nutriment to the body and to the intestines, where it would be processed and distributed to the body. How simple it is? It's not that simple. We try to simplify it as much as possible, but let's think about it in depth. It's a port of entry, as we have said. It has to be a clean port of entry. And you can see here healthy gums. Maybe it's a minor bleeding on this gum, but it's a healthy gums and mouth in general, compared to this mouth and to this port of entry. You have, these are not food remnants, these are bacteria that grow in the mouth and create this kind of environment that could be channeled all the way to the digestive system and inside the body in different way, not only in the digestive, but also in the bloodstream and in the lymphatic current. So all these bacteria can reach through the lymphatic stream or the bloodstream, all the internal organs, even reach the brain. And many studies have shown that everything that comes into the mouth and the bacteria are conveyed and could be transmitted to all parts of the body, like the heart, intestines, digestive system, respiratory system, uh, uh, diabetes, insulin, to the pancreas, to the brain, and also it could create adverse pregnancy outcomes. And most of these bacteria are related to all these diseases that are displayed in this chart. So, what about the pharmacist's role in oral health? Does the pharmacist play a role in the oral health? Definitely, the pharmacist plays a major or major role in the oral health because the pharmacist is the first line of support. It's not only on the oral health, but many patients do seek the advice of the pharmacist before seeking the advice of a doctor or a dentist. So it's very important to take this role very importantly. As you know, as pharmacists, many patients come to you and ask you, what can I do if I have a cough? What can I do if I have a digestive problem? What can I do if I have a oral ulcer or anything else before going to the appropriate doctor, whether it's an MD or a dentist? So the most important thing is how can the pharmacist identify the oral conditions? How can he recommend and over-the-counter products, safe products to treat this patient? Definitely, he has, as the pharmacist, has a role in educating the patient on prevention and taking care of himself, and definitely recognize the red flags and know your limit and know where and when to refer these patients. Areas of actions definitely educate the patient on oral hygiene and taking good hygiene, not only oral, but physical hygiene. But oral hygiene is our topic today. Brush your teeth properly, take care of the interproximal spaces, especially in elderly people, in young children. Mind your safe diet, avoid the sugary intake. And then when you are approached by patients for dental pain and tooth sensitivities, how to do it, how to address these things, mouth ulcers, aphthous, mucositis, and now it's the season in winter. Of most of the time, you get the what is called the fever burn on the lip, and these things: dry mouth, dry tongue, teething for young patients, for growing patients, dental abscesses, and elderly dental care. Oral hygiene is very important. Imagine a patient who has this type of oral hygiene. It is definitely, this patient is associated with many systemic diseases. Taking care of the oral hygiene is the first step in trying to help the systemic disease. Healthy gums and tissue. As you can see here in this picture, you can see that the tooth is connected to the bone, to the gingiva, and is retained in the bone by the ligaments. And when we have healthy gums, you have very healed and proper teeth, clean teeth and healthy gums. When the teeth are not clean and you have these calculus and the bacteria will grow in biofilm on this surface of the tooth, will provoke, with their presence and the presence of the toxins, inflammation and irritation of the gum. And they will diverse all these toxins into the gingiva that will convey them and create an inflammatory systemic inflammation. And this happens not only on the gingiva, on the level of the gingiva, also if the tooth is badly treated at the apical part of the tooth, where the root canal is supposed to be properly done, it also can convey these kind of bacteria. So as the mechanism of focal infection, and you've heard of the focal infection is when the mouse can convey a infection to a focal or focalized on the systemic uh, body, like the heart, intestine, pancreas, brain, creating meningitis or many other infections. It is due to the port of entry, as we said, the mouth. And it could create the metastasis of organism on the surface of the tooth, can create a homogeneous and lymphogenous spread. So it could be conveyed by the bloodstream or by the lymphatic system into the different parts of the organs. And the other also theory is the toxins that are diversed by these bacteria that are on the tooth and on the gums. They can be conveyed, the toxins can be conveyed by the lymphatic channel and get to a focus at the distant side, where it's like, as we said, the heart, the pancreas, the liver, intestines, brain, or a pregnant woman. So it goes in a circle. A bacteremia in the mouth can create a systemic inflammation in the body, and the systemic inflammation in the body would reduce and disturb the immune system. And once the immune system is disturbed, the systemic inflammation could create a more inflammation, and this inflammation, in the absence of the and disturbance of the immune system, would create more bacteremia and more inflammation and more infection. The prevention measures starts with a good oral hygiene, good and regular brushing. And here comes the role of the pharmacist, as we said, as a trusted entity by the patient to give them the instruction on properly treating themselves and doing a chronic brushing. And then refer these patients for professional cleaning and regular dental checkup. It helps when the pharmacist tells them, are you going to regular checkups once in a while? The focal infection starts with the bacteremia. And how does it happen? Every day, every time we brush our teeth, studies have shown that we go through a transient bacteremia. Why is it? Because when we are brushing our teeth, we create some microtraumas to the surfaces of the gum, and the bacteria that are on the surface of the of the tooth, when they are dislodged, they can go through the bloodstream, and you can create a transit bacteremia, whether through the bloodstream or with the lymphatic system. And the healthy body will fight this bacteremia and bring back a good health to the system. But when there is a reduced immunity system because of many factors, one of them is a consistent infection in the mouth, will break into a focal infection. So as we said, brushing can cause minor injuries to the gum, allowing oral bacteria to enter the bloodstream or the lymph stream. Dislodging the plaque during the brushing releases the bacteria into the mouth, some of which may enter the bloodstream and the lymph stream, and could reach, the most important thing is the heart. And in this heart, you have the valves. And as you know, many of our patients have valve problems. And the aortic valve is the most important one. And the bacteria that were conveyed through the bloodstream can reside on the affected valve and create myocarditis, valve infection, and present a health risk to the patient. The door is always periodontal, as you can see. Look at this periodontium. when you brush your teeth, where are these bacteria going to go? They will be conveyed, most of them to the digestive system, but many of them will also go through the bloodstream and could be conveyed to different organs, internal organs, and create infections and focal infections. Not only that, endodontics and the endodontic area where when we do treatment, and if we don't do a proper treatment and you get an abscess, and this is an abscess where it's a reservoir of bacteria that are conveyed directly to the systemic uh, blood and lymphatic systems to the internal organs. So a good endodontist, a good treatment with the dentist should be performed to prevent these kind of bacteriums. So, and the role of the pharmacist is not only just dispensing medications, but also educate on oral hygiene and educate on hygiene or in general. They can advise and recommend a good toothbrush, appropriate toothpaste, a proper mouth gargle, and you have many on your shelves. Here is some examples of our supported. Today's presentation is supported by Oral-B. And you have to instigate also and stress on the oral hygiene to reduce as much as possible the bacteria in the mouth. How do we reduce the bacteria in the mouth? It is not enough to do a mouthwash. Mouthwash does not clean. Mechanical cleaning cleans the half of the bacteria, at least half of the bacteria in the mouth. Whether it is manual brushing or electrical or mechanical brushing, but manual brushing at least is cleaning, and mechanical brushing, whether it is with the toothbrush or with the mechanical toothbrush, you will clean the bacteria, and then you will use interproximal brushes to reduce the bacteria. It could be associated with a toothpaste that will also help in reducing the bacteria count in the mouth. The mechanical or electrical toothbrushes clean much more than the hand if the patient is not proper with his hands. If the patient can do regular toothbrushing, yes, it can be equivalent, but in many patients that does not have dexterities or does not work properly with their hands, a mechanical toothbrush could be more helpful if it is properly used in the mouth and placed in the appropriate places to clean up the bacteria. Look at this mouse where we have a periodontal problem. We were able to maintain this situation for a very long time in a very clean environment, in a very clean mouth, with a hand toothbrush, interproximal toothbrush. But the patient is very well compliant and the patient has a proper dexterity in their hands. It is not given to everybody, but this is what we would like to see in the mouth of our patients. Clean gingivas, very pink gingiva, and clean teeth. Whether you use the toothbrush or you indicate for your patient a daily home care with the toothbrush, hand toothbrush, or mechanical toothbrush associated with a proper toothpaste and an appropriate mouthwash, you will be able to give the patient the best advices for a very good oral hygiene. And don't forget, a good oral hygiene and daily home care does not avoid the patient going to the dentist for a supportive once or twice or 3 times or sometimes 4 times a year, depending on the patient, how dexterity is good and how aggressive is the problem. Sometimes we see the patients once a year, sometimes we see them twice, or sometimes every 3 months, depending on how the patient complies with the oral hygiene. So regular professional healthcare cannot be avoided by daily home care. General healthcare, as we said, also can impact the oral daily healthcare. Look at this patient at her young age, beautiful and healthy. With the sclerodermia, she turned into this. As you know, sclerodermia is where the skin starts getting smaller on the patient, and things get shrinking. The skin will get shrinking, and it will suffocate the orgasm of the patient. Look at the nose of this patient, the lips, limitation of opening, limitation of breathing. Even the fingers cannot move easily, and bone is coming, protruding outside the skinny envelope. These patients do not have anymore the dexterity of cleaning and proper oral hygiene. This is associated with also a dry mouth. And there is no saliva in the mouth. And I can show you here the progression of the problem in 2017. And then about 4 months later, you can see the progression of the decay in the mouth of this patient. And you can see here at almost 1 year, the aggressive decay in the mouth of these patients. The absence of the saliva in the mouth of these patients. Saliva is not just a liquid. It is full of immunity and immune protein to defend the teeth and the gums. So these patients needs more care, needs more help in addressing their situation. For example, a mechanical toothbrush could help for this patient. Saliva substitutes, oral mouthwashes with fluoride can help, and definitely regular checkups and more than once a year for these patients to be helped for their situation. But when we have healthy patients and they are suffering from hypersensitivities, and we go now into the easy cases, and they address you, I have sensitive teeth, I cannot breathe air or drink cold water. We have to help these patients with giving them over-the-counter medication, but this as desensitizing agent, toothpaste, gel, mouthwashes. But also, we need to refer to the dentist because it's not always as simple as that. Because we have, before starting to recommend desensitizing agents, we need to screen the patient for decays, and sometimes decays can be obvious, as in this situation, or it could be in between the teeth that, as pharmacists, you could not see it. The dental sensitivity starts not only in the management of the sensitivity or the problem, but also in educating in good oral hygiene, and then definitely referring to a patient. When we talk about ulcers, and you have been solicited by many patients coming for you to asking about ulcers, it can go from a simple aphthous lesion, traumatic ulcers, mucositis, and also fever rash on the lip that is usually a virus. These symptoms start with a painful lesion, difficulty in eating, especially acidic food, cannot eat lemon. It is an autoimmune issue that disappears within a couple of days. After the lesions can be treated by either some gels that are on the surface of the tooth that reduces the nervous response to the stimulus, or could be a gel that creates a kind of film on the surface of the lesion, protecting it from the mechanical erosion on the teeth that provokes the irritation. Over the counter, as we said, protective gels, antiseptic rinses, topical anesthetics, but in topical anesthetics, try to advise the patient not to overuse because of the toxicity of the topical anesthetics. Dry mouth, xerostomia, and its causes. The causes are many. Could be medication side effects, the blood pressure medication, antidepressants for high pressure, and systemic disease like Sjogren, diabetes, Zika, or many other medications. The symptoms and starts with difficulty in swallowing, dry mouth, burning sensation, increased caries risks, and as I said earlier, when we don't have saliva, the risk of caries is augmented. As you can see here, you have cervical caries on this patient because of a very dry mouth. For the dry mouth, how can you help as pharmacists? You can help in prescribing the saliva substitutes and also the fluoride rinses to reduce the effect of the decays, and you can give sugar-free gums, lozenges like the citrus gums, citrus lozenges to stimulate the glands again to produce saliva. And hydration, water, gels, olive oil is very helpful in these situations and definitely reinforcing oral hygiene. When you are approached for the babies for the teething, it is very natural to have the eruption when the teeth are erupting and trying to push their way throughout the gums. Babies do get irritated. You can give them teething rings, cold compresses, advise the parents to use age-appropriate analgesic if needed, not all the time, but teething rings, cold compresses help a lot in these situations. And these are the teething rings, cold compresses, age-appropriate analgesic. Don't overuse topical anesthetics because of their toxicity for infants. Dental abscesses, when you are addressed by dental abscesses, you have to look at the tooth and you have to look at the periodontium. The abscesses are either due to the gum or due to the tooth, as you can see on the X-ray. But as pharmacists, you will be able to address the gums by reducing the inflammation with the mouthwash and instigating a very good oral hygiene, taking good care of the teeth, properly cleaning the teeth, cleaning the gums, using mouthwash, and the other situation, refer to the dentist for root canal and treat the teeth. So you manage the pain, manage the hygiene, and refer to the dentist to check on the abscesses. For example, these abscesses or white spots that you see here are not all due to the gingiva. They are due also to the tooth where you have deep abscesses in the tooth. Tooth sensitivity not only is induced by the exposure of the roots to the oral cavity and to the acids and to the sugar, it can be also a cracked tooth syndrome. You can see here a tooth that is cracked. The crack goes deep, and every time the patient was chewing on his tooth, it was very painful. These cracks, if they go very deep in the root, like in this case, are subject to extraction. They have to be treated as soon as possible to avoid the complications. When pain cannot be managed with the over-the-counter medication, definitely referring to a patient. Look at this patient complaining from pain, but this patient may have very bad root canals and should be addressed appropriately. Dental abscesses, localized infection, tooth and periodontium. Look at this gingivitis. This kind of very severe gingivitis of bad oral hygiene, interproximal oral hygiene, could not be addressed only in the pharmacy. And also this kind of abscess, which has to be removed, all the calculus that are below the gingiva should be addressed. So you can just indicate appropriate oral hygiene, indicate mouthwash over the counter, and definitely refer the patient to a dentist. So in the conclusion of this very interesting session, and in the conclusion of these 5 sessions, as we have said here, it is very important to understand the role of the pharmacist in the oral health team. It is very important, very integral in the treatment of the patient. Definitely educate the patient, advise the patient on which product is the best product for him, and definitely, if needed, refer the patient to the dentist or to the appropriate person to treat this patient. At the end of this presentation, I would like to thank you and thank your attention. I would like to thank Oral-B, who has been the main supporter of the series of 5 consecutive webinars, free webinars, gracefully supported by CAP. At the end, the last message would be, you will be receiving your certificates within the coming days. But again, I need to stress that you have to have attended the 5 series of these presentations to be eligible to receive the certificates. With that, I would like to thank you, like to thank our supporter for this series, Oral-B, and for CAP team for giving us the opportunity to air these free webinars. Thank you for your attention.